Welcome. Here are the 21 basic and important questions about OS and OT results in pharmaceutical industry. Subscribe to channel for more informative content. As an introduction, we will start this series of questions with very basic one. The question is, what is difference between OS and OT results? Here, values under blue line indicates OT result and values under red line indicates OS results. Consider the specification limit for the assay is 90% to 110%, and based on the trending we have set OT limit as lower OT limit 90% to 92.5% and higher OT limit as 107.5 to 110%. If observed assay value is 89.7 or 111.9, it will lie under the red line and we will call this result as OS result, that is out of specification result. If the observed assay value is 91.8 or 108.4%, it will lie under the blue line and we will call it as OT, that is out of trend result. What are the different phases of OS or OT investigation? As per US FDA's guidance for industry on investigating out of specification, that is OS test results for pharmaceutical production, October 2006, there are two phases of investigation, phase 1 investigation and phase 2 investigation. Phase 1 investigation is also known as laboratory investigation, which focuses on identifying laboratory errors. If the initial assessment indicates that no meaningful error were made in analytical method, full-scale investigation shall be carried out. Phase 2 investigation is including of review of production, additional laboratory testing and reporting testing results. What is obvious error investigation? Obvious error investigation is done to determine whether there has been a clear obvious error due to external circumstances such as power failure or those that the analyst has detected prior to generating data such as spilling sample. Examples of obvious error are calculation error, power outage, equipment failure, testing errors or incorrect instrument parameters. What is hypothesis testing? Hypothesis or investigative testing is the testing performed to help confirm or discount a possible root cause. That is, what might have happened that can be tested. It may include further testing regarding sample. As a part of investigation, multiple hypothesis testing can be explored. Is it mandatory to perform investigation if batch under investigation is to be rejected? Answer is, even if a batch is rejected based on the OS result, the investigation is necessary to determine if the result is associated with other batches of the same drug product or other drug products, and identification and implementation of corrective and preventive action. Batch rejection does not negate or avoid the need to perform investigation. Which are the commonly used investigation tools for OS or OT investigation? Broadly, we can divide the investigation tools into two categories. First, simple investigation tool and second, advanced investigation tools. In simple investigation tool, we can use brainstorming, report from SME, viva analysis, personal interrogation, review of previous history of non-conformances and process mapping tool for investigation. Whereas in advanced investigation tools, we can use 5 or 6M tool for investigation, fishbone tool for investigation, failure mode effect analysis, or rarely Pareto charts and scatter diagrams. What additional testing can be done in the phase 2 investigation? In phase 2 investigation, we can do resampling. That is, resampling should be performed by the same qualified and validated methods that were used for the initial sample. Additionally, we can do retesting a portion of original sample. The decision to retest should be based on the sound scientific judgment and the test plan must be approved before retesting occurs. Is the repeat testing till results come into specification criteria is allowed? FDA inspections have revealed that some firms use a strategy of repeating testing until a passing result is obtained, then disregarding the observed OS results without scientific justification. This practice of testing into compliance is unscientific and objectionable under CGMPs. Can we use the result outcomes from additional testing for batch release? Answer is no. Investigational testing or hypothesis testing may not be used to replace an original suspect analytical result. It may only be used to identify and confirm a probable root cause. What should be the action plan in case of laboratory or sampling error not confirmed? When the initial laboratory assessment does not determine that laboratory or sampling error caused the initial OS results, two possibilities remain: that the result reflects the actual batch condition or the result is due to unidentified laboratory error. Both the possibilities must be investigated using an extended investigation in accordance with the predefined procedures. Can we reject batch based on the initial OS results only? Answer is, an initial OS result does not necessarily mean the subject batch fails and must be rejected. The OS result should be investigated and the findings of the investigation, including retest results, should be interpreted to evaluate the batch and reach the decision regarding release or rejection, which should be fully documented. What are the basic requirements for the OS and OOT investigation expected from US FDA? As per US FDA's guidance, investigation should be meaningful, thorough, timely, unbiased, well documented and scientifically sound. This is written in the US FDA's guidance for industry on investigating out of specification test results for pharmaceutical production, published in October 2006. Why laboratory errors should be minimum? Laboratory errors should be relatively rare. Frequent errors suggest a problem that might be due to inadequate training of analysts, poorly maintained or improperly calibrated equipments, or careless work. Is it required to raise OS if OS result is observed during periodic testing, that is in-process testing done during manufacturing? Answer is no. In this case, investigation can be carried out through deviation and intimation about failure can be given to QC team. Whether it is required to raise OS if OS result is obtained during method transfer, analyst qualification or vendor evaluation sample. Answer is no. In this case, investigation can be carried out through lab incident to identify root cause. What procedure shall be followed for additional sampling and testing? Pre-approved protocol shall be used for additional sampling and testing for OS or OOT investigation. Detailed procedures shall be mentioned in the protocol prepared for additional sampling and testing. What are the commonly used checkpoints in phase 1 investigation or laboratory investigation? Following are the few checkpoints that are commonly used in phase 1 or laboratory investigation. These are analyst qualification and training on intended work, correctness of test specification and methods, instrument calibration and performance, preparation of test solution and dilutions, validity of reagents and standards, performance of system suitability and correctness of calculations, etc. What key points are covered during phase 2 investigation? Following are the 5 key points that are covered during phase 2 investigation. These are: first, review of raw material; second, review of manufacturing process; third, review of critical process parameters; fourth, review of calibration and preventive maintenance of equipments used; and fifth, review of environmental conditions maintained during manufacturing process. What should be the mandatory part of the manufacturing investigation? A written investigation record of the review should include the following information. First, a clear statement of the reason for the investigation. Second, a summary of the aspects of the manufacturing process that may have caused the problem. Third, the result of a documentation review with the assignment of actual or probable cause. Fourth, the result of review made to determine if the problem has occurred previously. And fifth, a description of corrective actions taken. What are the basic requirements for performing retesting? There are 4 basic requirements. First, it should have predefined retesting plan. Second, retesting should be done by analyst other than original analyst. Third, second analyst should be qualified at least like original analyst. And fourth, retesting shall be done from the same sample portion from which OS has been generated. This one is last and important question: what we should check during review of sampling and storage review as a part of OS investigation. We should check whether sampling is done as per SOP, whether sample stored as per specification or SOP, whether problem is identified related to sampling and storage conditions, and whether any other observations or remarks are made during sampling and storage conditions. Keep watching PharmGo. Subscribe to channel for more videos related to our pharmaceutical industry.